Allergic rhinitis is more than just histamine. Why do some people still have allergic rhinitis even after antihistamines, nasal sprays, immunotherapy, and sometimes even surgery? Because the real problem isn't just mucus. It's the immune system that keeps telling your nose to produce it. Hi everyone, I'm Dr. Mark, and at Chinese Doc Singapore, I work specifically with allergic conditions. Today I'm sharing about allergic rhinitis, but I also work with other conditions like asthma, eczema, and even TSW. In this video, I'll explain how allergic rhinitis is more than just histamine and why Chinese herbs may help by influencing the inflammatory pathways driving the condition. Most people think allergic rhinitis is a histamine problem. That's why we use antihistamines. But antihistamines is only one piece of the puzzle. Research shows allergic rhinitis involves type 2 inflammation. This includes cytokines such as IL-4, IL-5, and IL-13. These cytokines drive mucus production, eosinophilic inflammation, nasal swelling, and also airway hypersensitivity, which means your nose becomes reactive to dust, temperature changes, humidity, smells, and other environmental triggers. This is why some people sneeze the moment they wake up. The nose isn't simply blocked or dripping, it's inflamed. And here's where Chinese medicine starts looking at the problem differently. Not just what are you allergic to, but why is your nose reacting so strongly in the first place? In Chinese medicine, we don't just look at the nose, we look at patterns. Questions that are important include, is the mucus watery or thick? Watch this video about watery mucus. Is it worse in the morning or night? Is it triggered by heat or cold? Is there any eczema, any asthma, or any digestive symptoms we should know about? Different patterns may require different herbal strategies. The goal isn't simply to dry up mucus. The goal is to reduce the body's tendency to generate excessive inflammation and secretions. And here's something many people don't realize. Even if surgery opens the nose, inflammation can still remain. A deviated septum can block airflow. Enlarged turbinates can block airflow. Surgery can help, but surgery doesn't necessarily stop IL-4, IL-5, and IL-13 from driving inflammation, which is why some patients breathe better after surgery, yet they still have sneezing, congestion, mucus, and postnasal drip. The structure has improved, but the immune response has remained. That's why addressing inflammation remains very important. Now, the TCM secret isn't about herbs that magically unblock your nose. The real secret is understanding that allergic rhinitis is an immune and inflammatory condition. By selecting herbs according to the patient's pattern, we're trying to influence the inflammatory processes driving the symptoms in the first place. I recently treated a patient who had already tried antihistamines, steroid sprays, immunotherapy through Acarizax, and even nasal surgery. But still, he struggled with allergic rhinitis. Watch that case study next to see exactly how his symptoms evolved during treatment and what improvements he experienced. Thank you.